We also looked at diesel and as a sort of representative of the organic fractions, and we just didn't find any. And it wasn't picked up in the SCR 15 report. But what you see is if you go from the upstream measured values, you find no primaries. There were no primaries in exceedance of drinking water standards. In the slurry itself, that's the gray-headed column. And then to the right of that, you see the downstream measured. These are down gradient of the injection point. So these are in the mine or wells downstream or seeps that popped out on the side of the hill. The down gradient represents our best take on what impact the slurry water was actually having on that groundwater. And again, you'll see that there was no effect across the board with respect to primaries, drinking water exceedances. On the, there are two columns on the far right. There's the average slurry, average of the slurry affected. So I took those PM1 through PM13, averaged those out. That's the average that you find in the area downstream of slurry. I say slurry affected, it may or may not be affected. There's down gradient of slurry injection. And then I have, to the right of that, I have the mass balance estimate. In other words, that was the exercise I went through before, where you take the dilutional factors, the groundwater infiltration, plus the amount of slurry water added to its concentration, and that gives you how much you would expect to see if that was, in fact, a nice simple bathtub. So you get an idea of what is carrying through, and you'll see that the slurry itself, with respect to the secondary drinking water standards, is in excess with respect to aluminum, manganese, sulfate, TDS, and a lot of that carries over to the right. Now, we also know that a lot of these things, aluminum, iron, manganese, sulfate, and TDS, occur from acid mine drainage. Just in other words, if you expose coal mine to air and it is allowed to oxidize, you will get a lot of these same ions. So it's hard to attribute these specifically to slurry injection, but yet, if you look at the mass balance estimate, that gives you some idea of what you would expect simply from the slurry itself, and then you add to that what the averages might reflect what is being produced in the mine. So this is some way of getting an idea of partitioning how much is coming in through the mine processes itself and how much is coming in through slurry. So what we find is that these measures are affected by the amount of injected slurry, the volume, acid mine drainage just forming naturally. A lot of these mines are above gradient, so they're exposed to the air. They continue to generate sulfate, iron, and so forth. And those together ultimately form the mass balance analysis. All of these mines are relatively small, relatively small. I'd say a couple of square miles. I think the biggest one was 6.5 square miles. If you look at big mines, the big underground longwall mines, they might be in the range of several thousand acres. Something like Federal 2 up in Monongalia County is probably 15, 20 square miles, which is thousands of acres. So what you're looking at here is the effect of a lot of slurry injection to relatively small mines. The bigger the mine gets, the more infiltration water you get, the more your dilution becomes significant. So that's going to ultimately affect how this works. And what we're trying to get at is more a process for estimating in a particular setting whether you're likely to have problems relating to slurry injection or not. And so I think we've identified some of those factors, and I'll turn it over to colleague Dr. Beckman.
So, to review the thing that people want to know, does coal slurry underground injection pose a threat to the public health? Who cares? Well, we all care. Citizens care, especially those who may be affected. Coal operators have to care. Regulators certainly care. Here are our answers. We did not document a health hazard that is specifically related to coal slurry injection. No primary drinking water standards were exceeded. Secondary standards only were exceeded. And we cannot say when secondary standards were exceeded that it was due exclusively to coal slurry, although it does appear logically and also from our calculations that coal slurry contributes. Now, I want to stop on that one for just a second. There are secondary drinking water standards. Secondary, as you know, in this committee, secondary drinking water standard is supposed to be cosmetic, odor, taste, appearance. From a physician's perspective, that simplification has exceptions. There are secondary drinking water standards for things where we question what the future will hold in terms of our knowledge, such as aluminum. There are secondary drinking water standards for things that we know can become a problem, such as sodium. And the one that's really interesting, and especially interesting in this state, is iron. It's interesting in this state for a number of reasons, not the least of which we put a lot in our water because of our mining heritage. But in addition, our Northern European heritage makes a subgroup of us who have a genetic marker, a mutation, if you will, who are susceptible to a disease called hemochromatosis, actually quite susceptible to any increases in iron in the water. So it's a secondary drinking standard for most of us, and for some of us, it can be a significant problem. And it's not a trivial number of people who carry the gene. An estimate of the number of people who carry the gene, it's a recessive. In West Virginia, the two types is somewhere around 8%. So secondary drinking water standards are non-trivial. Because we could not find a health hazard exclusively due to coal slurry injection, given the available data, does not imply that the safety of this practice is assured. We're going to come to that. Each site is unique. No site has before, during, and after measures. The National Academy of Sciences, our most prestigious scientific body, has twice written about this process, and each time they have predicted that each site will be unique. And the data that you get from a site will predict well what will happen at that site. And we are adding that data gaps do not answer the needs of those who want to proceed with the process of slurry injection or those who want to stop the process. We can't assure safety. We didn't find a health hazard. There are some other findings. We model that the liquid fraction is most important for public health. Others have written that before. We concur. We assert again that no site is representative of other sites. Each site needs its own characterization before the process begins. Coal slurry injection can have both positive and negative effects on mine pools. The pH can actually get better. That was demonstrated about 20 years ago, and you can see that as well here. The regulatory framework in West Virginia requires that slurry injection not degrade water quality standards. But it does not require practice measures at this time to assure that the requirement is met. There are both theoretical and historic reasons to believe that coal slurry injection does not always work as intended, that it doesn't always stay below grade, that sometimes it may not even get to where you intend, and that pollutants do not remain indefinitely trapped below grading, and therefore it may contribute to degradation of drinking water. Other things to know: the groundwater infiltration is much greater than the volume of the slurry liquids in most cases. Bigger mines have greater dilution factors. And after some period, the mine pool will reflect what you're going to get from continuous addition of the slurry water. We ask ourselves the question, can we do better? To ensure the public health and the intent of the regulation, we think that probably if this process is to continue, that we can. If the process is to continue, a slurry monitoring program with repeated sampling, ideally which would start before injection, is suggested if coal slurry injection is to continue. What would that look like? If the process is to continue, we recommend that other state programs, such as those of Virginia, would be evaluated for what we can take away. We develop monitoring plans in our state with a characterization of what is needed before, during, and after injection. At all points of impact, surface streams, wells, etc., that need to be measured, be identified in advance, and that regular sampling of wells, slurry, and surface streams be done at the before, during, and after stage, and that the during stage would include periodic sampling.